You're listening to CDKL5 in color. I'm Marissa, and on this podcast, I'm joined by my co-host Amanda, and sometimes some very special guests to talk all things CDKL5 Deficiency Disorder. It's a rare genetic condition caused by changes in the CDKL5 gene. Patients with this condition often experience profound developmental disabilities, difficult to control seizures that start in infancy, cortical visual impairment, and a variety of other health concerns. It's a challenging condition, but we know that by sharing our stories, we can raise awareness, provide support, and paint pictures of our community that can lead to greater understanding and meaningful change for families like ours. Let's jump right in. Both of us have kids home.
Yes.
This is the life of parents and caregiving someone with CDKL5. That's a school day. And yet, for both of us, we're in the same situation. Our care team at school, my son's nurse, your daughter's paras, are out sick.
Yep. So that means even though our kids aren't sick, they're home with us because the level of care they need at school is not easy to substitute.
That's exactly right. So we're making it work. Gregory's here with me. He's in his stander, and he's a pretty quiet guy, so I think we should be okay. Where's Ava?
Ava is hanging out for a mid-morning nap. She's had a couple of snacks since breakfast, and my hope is that she's not getting whatever her parents have.
Oh, I know. Well, fingers crossed. Today, we are talking seizure action plans, and we're doing it now because February 10th to 17th is Seizure Action Plan Awareness Week. And the Seizure Action Plan Coalition, which is managed by Epilepsy Alliance America, they have a fabulous website that I encourage people to go check out to learn more about seizure action planning and see examples of different seizure action plans. And I'll put that website in the show notes, but it's seizureactionplans.org. They also have a lot of awareness information on their site, and I was looking at it. And Amanda, did you know 70% of individuals with epilepsy do not have a seizure action plan in place?
No, I didn't know that. I mean, maybe 50% might not have been as shocking, but it's a little bit, it's shocking
70%.
actually.
Yeah, it was really shocking to me too, especially because having a seizure action plan is a relatively simple thing to do to protect yourself, right?
Yeah.
And to inform and educate the people around you. Well, let's tell people what a seizure action plan is in case they don't know.
Yeah. What is a seizure action plan? Well, simply put, it's a document that you work ideally with the team that's treating. It's usually your neurologist or epileptologist, whoever's treating your child. But it is a document that tells folks what to do when somebody's having a seizure. It normally describes the seizures, lets you know when to administer rescue meds, and also can talk about some things like what triggers seizures, maybe times that it's not exactly the emergency that it might appear to be. And, really it's very clear on when to call 911 and when to give rescue, both. And that can be very different for different types of epilepsy patients. I think that's important to state. Like, my daughter can have a fairly long seizure before we're giving a rescue med. And we would certainly want to know that she's hypoxic before calling an ambulance for her, because the types of seizures she have can cluster and go on and on and on. So, I mean, just, think about places your child's going to be without you and how you're going to communicate what to do if your child has a seizure.
Yeah. They're really individualized, and you can make them as individual and specific as you need them to be. And we know our kids are complex, and what might be in a standard seizure action plan, like I feel like the default is administering rescue medicine after 5 minutes is like the default. But the beauty of a seizure action plan is that it's individualized to the person who has epilepsy to manage how their epilepsy presents for them. And what's nice about writing it in conjunction with your neurologist is that you're leaning on their expertise, but you as a caregiver are also a really important voice into making sure that plan reflects what you would do to address the situation, what you want someone else to do.
Yeah. I mean, we've come a long way in understanding and advocating for epilepsy in, the 20 years I've been involved in this. But when Ava was younger, I had some real issues with the school not wanting to follow the seizure action plan we had in place because they felt there was a liability there if they didn't do what they read online was standard for. And I shouldn't even say what they read online. Sometimes it's having a nurse who doesn't take the time to understand it or doesn't want to risk the the information the doctor's telling them to follow. So I think you can put a seizure action plan together without a doctor's signature. If there's people in your house and you want to tell them what to do, there's a lot of forms available. I think even at the Epilepsy Alliance website, just to help you put a seizure plan in place for people who are helping you or your loved one. Don't be afraid to advocate in other spaces if the seizure action plan you're trying to have them implement, if they're not comfortable with it.
Right. And that's really where your neurologist can help you too. Because what they're
Yes.
looking for is not to rely on the parent. The parent said I
Right.
could do, right? There, no,
Right.
the doctor said.
Yeah.
And it's so funny because when your kids in the school system, if they have medication orders, or like my son is tube fed, so he has nutrition orders, he travels with oxygen and suction, so he has pulmonology orders. Those are written by the doctor, and I've never gotten pushed. First of all, I've never gotten pushed back about his seizure action plan, but I know some people in our group have sometimes struggled with that. You don't. That seems to be the one that you might get pushed back on, as opposed to the other orders where they're signed by the doctor.
Yeah. I mean, and maybe it's just an information gap, right? And people are catching up and getting more familiar with it. Seizures are so misunderstood in a lot of different ways, and they scare people. I mean, I'm so conditioned to it that I think people are really shocked sometimes to see my lack of enthusiasm when we're in public having a seizure or something. I've been in the Costco parking lot and transferring Ava maybe out of a chair to put her in the car. And one day she had a seizure and I had to just pick her up and put her in the back of my Sequoia until she was done. And somebody tapped me on the shoulder when things were kind of like winding down and said, "I'm a nurse. Do you need me to call 911?" And I was like, "No, thank you. I appreciate you coming and recognizing and not freaking out and, waiting to tap my shoulder until this potential time." But I mean, be prepared is what I guess I'm saying. Prepare the people who are going to be around your child in places you're not, because it'll save you a lot of heartache. None of us like to go to the hospital. An ambulance ride to the hospital that is not necessary. It's annoying. It sounds maybe flippant for me to say that, but one of my biggest goals is like, please call me if you call 911. I'm not going to make you call me first, but please call me, and I would like to talk to the EMTs who triage her before they take her somewhere. We've never had to take it that far, but they do call me. She's got clusters written in. If she has more than 6 clusters in an hour, they call me when the 5th cluster happens and say, "Do you want to come get her? Do you want us to give her medicine? What do you want?" And so it's some other ideas to talk with your team about. Like, when can they call you instead of waiting till it's too late and having to.
Yeah, no, that's really good. You're exactly right. And that's why it's so nice if you can have a good relationship with your child's school team, building that
Yeah,
relationship
that
where there's comfort on
rapport.
both sides to go back and forth.
Hmm.
We're fortunate to have that too.
Yeah.
When you say seizures are scary to people, it's so true. We were just at a GI appointment yesterday, and my son was doing this weird thing. I don't know if it was a seizure or not. He hadn't had any seizures for like 12 hours, which is unusual. And so he was doing this sort of jerking, kind of weird behavior, something neuro. Something neuro is happening. I
Yeah.
don't know what it is. It could be a seizure. The doctor was very concerned about it. And he's like, "I want to let you know I'm concerned this could be a seizure." And I was just like, "I hear you. I hear you." I'm not super concerned about it, but if it continues or it doesn't stop, I will, believe me, I will take actions that I need to take. But
I've had that experience, in a lot of different settings where I'm like, "No, we're not going over to the ED," or "No, we're not giving her rescues," or, I still sometimes walk into her for a dental appointment and she goes to the dentist at our children's hospital still. The dental team will be like, "Do you have rescue meds with you?" Like, why? Like, there are rescue meds in my car, but she's got to seize a long time before we're giving her rescues. And I'll walk out to my car if I need them. I've had to have some back and forth with the dental team before they do a cleaning on her if I don't have a rescue med to show her. "Well, we don't want to have to get it out of the closet." And I'm like, "You'll have time." So, I mean, I appreciate people, but I mean, I guess that's it. We're living with a disorder that the epilepsy is not going to stop. It's not going to be controlled. And sometimes over treating seizures as an emergency can snowball and cause you other problems. Rescue meds are nice when it's an emergency, but they can be problematic if you're giving them often.
it's just reflecting how people who don't live with a rare epilepsy or a developmental an epileptic encephalopathy like CDKL5,
Mhm.
they really are clueless as to the severity of epilepsy that is normal for us. And
Yeah.
that's why a seizure action plan is so helpful, because you're being really specific and detailed about what the person should be doing and taking the burden of decision making completely away, because the plan is telling anybody who's following the plan what they need to be
What
doing
and when. Yep.
and when and
Yeah.
how. Do you remember back the first time you ever wrote a seizure action plan for Ava?
So when Ava was little and undiagnosed, she went through all of her early intervention in preschool at a private school called Anchor Center for Blind Children in Denver. And I had to drive about 40 miles every day. And I obviously hung out somewhere close, whether it was in the building or in the neighborhood near them, because, I had to bring her back home. There was no transportation or anything like that. So I was relatively comfortable, and they were as well, just kind of with me being there and me dealing with things if she got out of hand. But when we went and transitioned her into public preschool, and that's when I set up a seizure action plan. There was one person on the team who was like, she should probably have a nurse here. And the nurses, in their discomfort, I finally figured out that the Epilepsy Foundation was one place I could get the nurses some support to get them to a comfortable place with her. The Epilepsy Foundation actually offers school nurse training. I think it's a national program. And a good part of me getting a good seizure action plan in place at that time was convincing them they needed to be comfortable with what the doctors and myself were communicating to them on that plan, because they kind of had this attitude of like, well, we have liability, and if we feel like it's not going well, we're going to do what we're going to do. So, it's a dance, and you pick your battles, but eventually we worked through to where they became comfortable with a plan of like 10 minutes or 6 clusters in an hour. But that wasn't the initial plan. And when Ava was little, your only option was diastat. And I
For a rescue.
hated, yep, for rescue. I didn't love giving diastat anywhere in the public.
There's a rectal,
And
right?
yeah, it's rectal. And, there was, dignity. There was things that I just was really concerned about. And I'm like, you need to be sure that she absolutely is in an emergency situation where she is losing oxygen before you put her through this. Because once again, my daughter does not get hypoxic to us. We don't have the same emergency that somebody having a diabetic seizure, as an example, has. She's likely not ever going to die from seizing. She can seize for hours. And I think that might be a good conversation. But if you have to get your point across, it's that my kid can seize all the time. Like, she used to seize all night long and not sleep. It was called ESES. So you're going to run into different folks with different comfort levels. So, advocate when you need to.
Yeah. And you can start in one place and get to another place. Like,
Yeah.
thinking back to the first time, similar to you, the first time I ever wrote a seizure action plan for my son with his neurologist was when he was transitioning into the school system to preschool, because it was required. And the seizure action plan we had when he was 3 doesn't look like the one we have
Right.
now that he's 8. So, it's, first of all, a plan that should be reviewed annually. It's a plan that should be reviewed and updated anytime you make changes,
Hmm.
anytime there are changes, new
Yeah. Your
seizures,
meds are
different
listed.
seizures, yep,
Yeah.
medications, all that stuff. Yeah, it should be updated and reviewed. But it can also be changed. So if you feel like there's new triggers or there's new comfort care that you want to see provided to your child, you can make a different plan and edit it and update it. And my experience is, the first time you do something with people who are just getting to know you, it looks one way. And then as you continue to build and foster that relationship that you have with the school, it's one of the most important relationships you're going to have. And time goes on and they get to know your kid, then I feel like it's an easier process to say, I want it to look like this. A lot of times you'll find that they're in agreement because they know your kid. We're all doing what is in the best interests and the best actions to be the most supportive of our kids we can be. Everybody wants that. I truly believe it. Most people, anyway. Hopefully, you're with a team that also wants that. But, if everybody's goal is to manage the seizures and the epilepsy the best way they can and respond in the safest and comfortable way, you should be able to get on that same page to have the
Yeah.
plan look like the way you want it.
Yeah. And I want to add, like, Ava ambulates, so her transportation was on a minivan, and oftentimes she would be on a minivan with maybe an adult in the front seat. I always worried, like, if there's a car wreck, Ava's nonverbal. Like, how is anybody going to know who Ava is in this car if this van driver is, incapacitated in some form? There was a lady she had worked a little bit with emergency responders through some school psychology classes she was doing, and she had actually asked me what I would like to see done. And I was like, I would like to see some kind of traveling binder that talks about all the kids in this car and what they might look like, because she's nonverbal. Like, if she can't respond to you, she might be okay. Like, you got to look a little deeper if they have a car accident. So, don't forget about those kinds of places to do some education and advocacy. I wanted the EMT to have a seizure action plan that they could take with them if they sent her to a hospital that wasn't familiar.
That's really interesting what you said about the binder and being in an accident. I've sometimes thought about if I was transporting my son, he's in a wheelchair, and we have a wheelchair van. If we had an accident and I wasn't alert, I don't want people giving him water in his mouth. Like, so I have hanging on the back, because he doesn't do anything by mouth, hanging
Mhm.
on the back of his wheelchair, like, he doesn't take by mouth, he's tube fed, he has epilepsy, he's visually
NPO, yeah.
impaired, like all of the things, like he doesn't speak, because somebody coming up upon your kid, like you said, somebody just came up on Ava and they didn't realize not speaking is her normal. When I take Gregory to the emergency room, they'll ask me. So now what I've done is I bring videos of him in my phone and I'll say, this is what his normal looks like. Look at him. And then they can be like, oh, okay, yeah, he looks really sick. Because they'll say, "Oh, I know he doesn't speak. Is this sort of how he is?" And he's like comatose on the bed with a fever, and like no. I know he doesn't speak, but here's a video of how he can move. He does move, and he doesn't move a lot, but because it's hard to describe somebody,
Yeah.
and yeah, that's another good tip is to have videos of your kid. I'm sure we all have them on our phone and show them in the emergency room, in the ambulance. This is what they're normally are like, just so you have an idea,
Yeah.
a
I mean, another
comparison.
time that I had to use my seizure action plan where it came in handy was Ava had like a drop seizure. I think it was more myoclonic, but atonic or something. And she was sitting on a chair and she fell face first and I wasn't there. And like a melon, like it sounded like her head exploded. Well, she fell face first, broke her nose. And there's a lot of things I can triage, but like blood everywhere is not one of them. I was like, oh my goodness. There's a major hospital system very close to me. So I take her over to this hospital, MCR, and I walk into the emergency room. I am covered in blood. She has blood coming down her face everywhere. And people are like, it looked like crime scene. And the people sitting there were like, oh my God. MCR, this is like an adult hospital. It's not a ped hospital. They could handle certain things, but they were like, what do you want me to do? And I'm like, well, what do you usually do to assess someone? I really need somebody to like,
Can you stop the
stop
bleeding?
the bleeding or something. Like, I probably should have just called 911 and had the EMTs triage her. But, I showed them finally her seizure action plan. She takes a lot of meds. She's not going to talk to you. I need to understand what I need to do to fix this like ortho situation. And he was like, I would feel a lot better too if we could just do a quick CT scan before she left. And I'm like, that's fine. We'll do that.
I want us to talk about our experiences before school and access to daycare or lack thereof, because I think that's really an interesting thing that I'm not sure everybody
Yeah.
has heard before. So,
Yeah.
when Ava was a baby, did you intend to put her in daycare?
I intended to go back to work. I was getting ready to take my CMA exam. I'm an accountant, and it's a managerial accountant exam. Anyways, I had Ava, was getting ready to take this exam so I could move along with life, my professional life, and she started having seizures. So the plans I had for her to go to daycare immediately went out the window because an infant who has epilepsy and the level of epilepsy my daughter was having, it was not going to happen. I think it was the first thing that really opened my eyes to how much this disorder was going to change not only her trajectory, but mine. It really felt like it had stolen my career and my, everything I had worked for at that point in my life for. So, I think I don't have the experience of an infant going to daycare, but that's a very important place to make sure they're trained and will take a kid. And I know in major metropolitan areas, sometimes the children's hospitals have daycares where they will take kids like that. But If you're lucky enough to have someone brave enough to take your infant, be sure they're trained. And
Yeah.
I mean, I mean, I know Gregory
Yeah.
started having seizures much earlier, but I assume you were going to go back to your social work
I
and
was. And I'll give a shout out that we have an episode coming with another CDKL5 mom, and we talk a lot about career and the impact that CDKL5 has had on jobs and that whole part of life that for most of us, I would say, and especially for most of us moms, gets turned upside down. I had the same experience. So I worked in the school system, a school social worker. I intended to go back after my maternity leave was over. And I had been scouting daycares and touring the daycares, and I finally picked one that I felt comfortable with and I really liked. And I did intend to go back. I didn't want to lose my spot in my really good elementary school that I loved with my coworkers that I loved. And so, yes, I had picked a daycare that I was happy with. And then he started having seizures. And as all of the appointments started coming and early intervention and all of this, I was sort of thinking in my head, I don't know how I'm going to really be able to manage this. But I still sort of thought I could. So I went to the daycare and I said, I just need to, my son's supposed to come here in like 2 months and I need to update you on what's going on with him. And the woman was very sweet, but she basically said, well, if he's having seizures every once in a while, like a couple times a year, once a month, like once in a while, then yeah, maybe. But every day, multiple times a day. And not only that, he was on thickened fluids and he had a lot of
yeah.
stuff that he needed and early intervention. So sometimes early intervention would go to the daycares, but it just became really clear that I needed to be with him. Really, I didn't want all of that on somebody else's shoulders. But yeah, they flat out weren't going to take him with that
Well,
many
I
seizures
mean,
anyway.
you're managing it whether you're implementing it or not, right? You've got to be the one doing all of that work, whether you go back to work or not. So hats off to everyone who can make it work. The management of this disease it's never ending and it's intense. You have to be on top of a lot of things that aren't the everyday things. And I think that's where we sometimes get a little bit burnt out and can give ourselves some grace when we do things like take time off from therapies or maybe, just crossing out one medicine and writing in another on the seizure action plan if you don't have time to print it out again and make it all nice. Good enough is good enough in the seizure action plan. But just make sure you have something for people to.
Yeah. I have on my fridge clear hanging folder that has in it my best attempt at documenting all of the stuff that I have in my head in case, God forbid, something happens to me. How do you make Gregory's food? Where do you order things from? Who are all of his providers? I mean, he's got 4 different DME companies. Why can they not all be the same? Come on. My best effort to put everything there that I have in my head that's not documented anywhere else. And I keep a running Word document on my computer that'll update, you know, changes to his feeding regimen, changes to the rate of his pump, updated information about providers, where he goes for therapy, where he gets his orthotics. I mean, all these, how to clean the suction, how to clean the cough assist, like everything that I have in my head that somebody else will need to do if I'm not here, and his seizure action plan and his medication lists and all of that information. And I know that for all of us who live with any medical or any special circumstance, having that information to whatever detail level you want available on your refrigerator for first responders. I just want to give a shout out to that's also a place to stick your seizure action plan and any other relevant information that people coming into your house for an emergency might benefit from knowing.
Yeah. And I would just say that for us, I provide medical care in the house for Ava. She has a charge nurse that comes in every couple months. So that whole plan that details between her doctor and the nursing agency what she needs and why we do this, we have that. I actually have like a snapshot kind of what, some priorities and where are the meds. I box meds up. Now that Ava's an adult, I have a lot of things I have to document for the state just because she's in my house and they want a seamless transition should something happen to me. But it is an overwhelming amount of information. So if you can just pull a snapshot out of the most important things that they need right then, or that you would want addressed right then, and have the rest for them to go through in their time And that's going to look different for all of us. My big thing is Ava doesn't have it too, but you've got to know that anything PO for her has to be like a chunky to smooth blend. She's just got dysphagia. Like, she doesn't chew and swallow like we do. So I always worry a lot about choking, and even them not understanding she needs food by mouth and she's not going to ask for it, right? Like, so some of those kinds of things I just think about too.
Yeah. It's really amazing what our kids need and what we go through to care for them. I mean, sometimes it really blows me away a little bit that this
Well,
is how we
I mean,
live.
that's why we become like we become, honorary members of a lot of these different clubs, whether it's OT, PT, speech, nursing, whatever it is. We sort of have to get acquainted with it and understand why we're doing the things we're doing. And I think it takes a lot to get this stuff started, but once you have it together, it's really easy to update. So try to get something started and some kind of system that works for you so that you can share with other people, right? I know,
Yeah. Don't be afraid to speak up for what you want written down there. I mean, if there's something that you really want to see happen in terms of even post seizure comfort or any sort of special circumstance you might want to see reflected in the plan, put it in there.
Mhm.
It's your plan, your child's plan to look how you want it to look. So don't be afraid to speak up for what your child needs. Great. Well, I'm glad we
Yeah.
could chat about this topic and hopefully it's helpful to people. And check out the show notes because we'll have some links in there for you.
Yeah. Go check out the website too with the seizure action plan information. It's a lot of good
Oh,
stuff.
that's right. Yes.
Yeah.
And I want to give a shout out to our own website, which is www.cdkl5incolor.com. There you can sign up for our newsletter. So hopefully you can get in there and get on our mailing list so we can keep in touch. All right. Thanks, Amanda.
It's good seeing you today.
You too. Bye.
Bye.
Thanks for listening. We hope you'll follow us on social media at CDKL5 in color on Instagram, Facebook, and LinkedIn, and visit us online at www.cdkl5incolor.com. Have questions or a topic you'd like us to chat about? Would you like to be a guest on our podcast? Email us cdkl5incolor@gmail.com, and we'll be in touch. Until next time.